My name is Mary Wells and I'm the Professor of Cancer Nursing Research and Practice here at the University of Stirling, and I work in the NMAHP Research Unit. I was on the steering group for the first cancer patient experience survey that has ever been done in Scotland. The survey's been carried out in England and also in Wales and Northern Ireland and has been very influential, but this was our first opportunity in Scotland to do the survey. And I was asked to do the analysis of the free text comments, which were the comments that patients made in their own words. Around 5,000 patients across Scotland answered the survey, and of those, more than half of them wrote some kind of free text comment about their experiences of care. So we had more than 7,000 responses to look at and to analyse, and we essentially did a qualitative analysis of those comments to look at what the key themes were of patients' experiences, both those that were positive and those that were negative. When we looked at the balance between more positive and more negative comments, we did find that there were more positive comments overall than there were negative. What was interesting about those was that the positive comments tended to be very short and said things like, "The team were great, my care was excellent." Whereas the negative comments gave us a lot more detail about kind of personal experiences that people had had, and often provided quite powerful stories in people's own words about things that had happened to them and ways that they'd been feeling. So what we found really by looking at the positive and the negative comments were that there were two kind of core issues that seemed to matter to people. And the first was about feeling like the system itself was geared up to your needs, and that wherever you were in the system you felt that people knew what was happening and that you were part of that dialogue. The second thing that we found were that people being treated as an individual was very, very important, and that things fell apart for some people when they felt that their individual needs weren't met. When we looked at the balance between more positive and more negative comments, we did find that there were more positive comments overall than there were negative. What was interesting about those was that the positive comments tended to be very short and said things like, "The team were great, my care was excellent." Whereas the negative comments gave us a lot more detail about kind of personal experiences that people had had, and often provided quite powerful stories in people's own words about things that had happened to them and ways that they'd been feeling. I think the free text has been really important in this survey, because in multiple choice questions you can only say so much. You can tick a box, but it doesn't actually tell you about the personal experience that the person has had. And in Scotland, person-centred care and patient experiences are at the core of the quality strategy, so it's something we're really interested in finding out about. And quotes that patients have actually said are often very much more powerful at conveying the reality of what it feels like to be a patient than a percentage. I think there are two key messages for me from the report, and they're maybe not that surprising, but they're aspects that we really need to work harder at. One is that every encounter that a patient has with the health service, from the time when they're worried about having cancer to the time when they finish their treatment and they're going back out to try and live normally, or as normally as possible, every encounter really counts, and that feeling that everything in that journey is joined up is actually really, really important for people, and I think we have some work to do there. I think the other thing is that when people finish their treatment, it's often very, very difficult to pick up the pieces, and this report, I think, shows how their experiences earlier on and their experiences when they finish treatment actually are important to consider in how we provide better support mechanisms once they finish treatment. And that's something that the Scottish Government are working very hard on at the moment and Macmillan with the Transforming Cancer Care After Treatment programme.